Hello everyone, thank you so much for watching my videos. In today's video I'm going to teach you about what we call dementia, uh, because majority of us have our patients, we have our grandparents, our grandmoms who are having problems. So sometimes people believe they are demons, they are what, but in today's teaching I want you to understand what dementia is, the causes of dementia, how to manage someone with dementia. Okay, so without wasting time, let us dive into our discussion today. So dementia, we call it the disease of the elderly. So it affects people who are from the age of 60 years and above. When it starts below that, before the age of 60, it is called presenile dementia, because they are started before the age of 60, but it always starts from the age of 60 upwards. So dementia comes about when your brain cells are worn out. So when those people are growing up, the brain cells get worn out, like you see how our shoes, when you are moving on the tarmac road, you find your shoe was good, but now this time the shoe is what? Is reduced. So that is the same thing with dementia. So as a person has grown up and reached that age of 60 years and above, their brain cells are worn out. So they start suffering from what we call dementia, or the disease of the elderly. So what are some of the causes of dementia? Okay, so dementia can be due to age, like we have said, 60 years and above. Also, it can be due to the general conditions. For example, if someone has a diabetes, or someone has pressure, or we call hypertension, someone has these other chronic illnesses, they can cause what we call dementia. Okay, and any other infection can cause what? Dementia. So what are some of the signs that we notice in people with dementia? How can you know that your grandfather or grandmother or your parent or your father or mother has dementia? One of them is always memory loss. So these people are always having forgetfulness. When you come and say, how are you, my daughter? What is my name? They cannot tell your name. So forgetfulness is one of the major signs of dementia. So these people are always forgetting, and learning new things is always hard for them. For example, if you tell them that today we do this like this, this is Jaja, this is what we do. Maybe I've given you 50,000. Do you know the person who has given you? If you tell them to repeat after, like maybe say 2 minutes, they will not remember that. So learning new things becomes hard for people with dementia. So another thing is those guys can be talking to people who died long time. Okay, and most of us, when we see that, we say, maybe my grandfather or my father is about to die. No, the brain cells have worn out, and you find these people are talking to the people who died some time back. There's one who was also talking to the sweet potatoes, you know, like she's an elderly person, but these people are complaining she's what? She's talking to the sweet potatoes. So those ones, we call them hallucinations. So we have different types of hallucinations. Like an hallucination is perception without an external stimulus. Like you are here, you are seeing like a lion, but there is no lion. So that is an hallucination. So we have the eyes, we have the ears, we have the senses of feeling, we have the taste of the tongue. So each of them has a different types of what? Of hallucination. So if you are seeing things which other people are not seeing, that is called visual what? Hallucinations. If you are hearing people talking to you, but people around you are not hearing, that's are called what? Auditory hallucinations. So our people of 60 years and above, if they are suffering from dementia or the disease of the elderly, they can have what we call auditory hallucination. They can be hearing people talking to them, which other people are not able to hear. It can be one person, 2 people, 3 people. Okay, sometimes they see things, they tell you that I am seeing so and so, maybe who died some time back, but for you are not able to what? To see. So that is a sign of dementia. And also, if someone is in a dark place, that thing always worsens also. Okay, the signs of dementia always worsens, and as I've told you, one of the signs that we saw there is forgetfulness, and also seeing things which other people are not able to see. They are talking to people who died sometime. So those are some of the signs that you can see that your father or mother or grandparent has what? Has dementia. Then the last thing may be how to can manage someone's dementia. How can you manage someone who has dementia or disease of the elderly? The first thing is that you have to ensure that this person is in a good room with good light. Why? Because these people, they when they are in a darker place, it confuses their brains. So you have to ensure that when someone is sleeping at night, ensure that we have enough light in the house. Ensure that you have a calendar. Okay. Ensure that you have a wall clock. So every time you have to orient your grandmother or your grandfather. So like if you ask them, what's the day today? Say the day today is 2nd of December 2025. So you have to remind them that today it is 2nd of December 2025. What is the name of this person? My father. The name of this person is John. Okay, is your firstborn. He has come to see you. So you have to remind them of the things that they have forgotten. It boosts their brain. Okay. If you are managing such a client in a hospital setting, we recommend that you don't change nurses. If it is one nurse who is managing that client, then it should be one nurse. If there are two on the shift, then there should be only two. So avoid changing the nurses, because these guys will not be able to remember their names. Okay. Then also we have talked about telling them about the days of the week, about the names of the people at home, because they always forget. Then the next one, we have also to identify what is causing this dementia. Is it because of age, or it is because of the sickness which is affecting them? For example, if they have diabetes, make sure that their sugar levels are controlled. If it is pressure, make sure that their hypertension is controlled, their BP levels are controlled. Because when you control them, even those symptoms will disappear. But if it is due to age, then also we shall be able to also to manage that, knowing that it is due to age. So we have some medicines that we give, and also depends on the symptoms. If someone has psychotic features, or is seeing things that you don't see, then we shall write medicine which you call antipsychotics. If someone is having maybe depression symptoms, also we can write something of depression. Then there are also other medicine that we use to boost the brain cells. So thank you so much for watching. If you are new to this channel, I request you to subscribe. And if you like this video, if you have gotten some knowledge about it, I also request you to like, comment, and share with your friends, because this information is very important. Let us share it with our relatives, our family members, and let us promote mental health together, because most people are biased about mental health. So thank you so much for watching. If you are new, please subscribe, because it motivates me to make more videos. See you in my next video.